Oh, hold on. Let me
Ready to
start
go?
again.
Okay, welcome to the December 16th Public Transportation Meeting. So we got two agenda items. The last time we met, we were talking about the shopping center extension, sort of like limited funding. We've had a lot of movement since then. And then we also have Dominic Branty from the Independent Living Center to have like a proposal around changing the route. I was wondering if maybe we should do Dominic first, just so Dominic can do the presentation and get out of here. What do y'all think about that?
Yeah.
Okay.
Sure. Dominic, you want to come up to the table?
Sure.
So does my jacket.
Yeah.
Just want to know.
Here? Yeah, sure. All right.
All right. Thank you for meeting with me. I know that you didn't have anything really scheduled, but I really appreciate it. Four, that's enough. So after talking with Michael, and you know, the initial thought was to change to see if our site could be our new site that we're planning on across from Greenport Town, the old Holcomb. We're looking on taking over the bottom floor. It's a bigger space. You know, we're growing. We have 4.5 staff. So it's getting, you know, where we're at now is we've been there for 20 years. And it's overstayed. And there's some issues with the building, with mold and things like that. So we have to basically move. After talking to Michael and then, you know, thinking, you know, the plan, I think the better plan is to ask for a rider initiated deviation. It looks like 8th Street, you know, the location is a little over a mile from 8th Street to 8th Street stop on Warren Street. I thought initially the company, the one I read must have been old because I thought it was a 2-mile deviation, but now I guess it's 3.25 mile. So it would have to be like an understanding that you know, either a waiver or you know, that it could be you know, a spot, you know, for a deviation. I did some data collection, and we have a staff that will probably be using it 3 or 4 times a week. She lives in Hudson. I have 3 individuals that live at Crosswinds, which is another bus stop. I have a volunteer that lives at Johnson Commons. I have someone that serves at Green Park Garden Apartments, and I have some sprinkled down in the city of Hudson. Now, this doesn't mean that it's going to be an everyday thing, because depending on the need of the individual, it could be a renewal of Section 8. It could be, you know, a SSA conflict or something to do with Social Security. So it's not an everyday thing. Our volunteer comes like maybe once every 2 months. You know, so the only one that's probably going to be every day is probably going to be the staff member. You know, that will be using that location. It should probably be picking that to bus up at 2nd by Bliss Tower. She lives down by Bliss Towers. That's basically, you know, I don't know, you know too much about the Independent Living Center. We serve people and seniors and individuals with disabilities from kind of like a one-stop shop, from advocating for them, for their rights, from advocating, you know, with Social Security, for housing rights, accommodations. I do school, children in school, you know, advocating for their rights that you have an IEP. And so we also do advocating with issues. You know, the most recent was the hospital. Their staff were parking in handicap parking and taking up on handicap parking. So I worked with the hospital to work on a system with HPD, what a contract they could ticket the individuals that are parking in handicap parking. because I was getting reports that people were going there 6:30 morning to do blood and there was no parking. But it's just because the staff at night were parking in handicap parking. That seems to be resolved, which is great. The other advocacy was the school board election. The county has, the adaptive accessible for people who are visually impaired. However, when I went to vote, school board did not purchase that after being told to purchase it. They did not purchase that device. So lucky someone was there with me. Otherwise, I would have lost my vote because I would not have been able to use the device. So I advocated with the school, school district now is going to be purchasing the two devices for each, voting area for the school board. So that's just some of the things we do. We have our main office in Troy. So we have staff that deal with other things that will come down and meet with individuals, especially if it's Medicaid related or if it's benefit related. We have staff up there that are trained, and they will come down to the office and meet with people in the office for to assist them with their needs. So that's basically in a nutshell. I mean, it would be a compromise. I think, in terms of that distance. I know in the past that there has been some, with the college and some things, there has been precedence for some trials and some things like that. So I don't know, his thoughts on if this could be a possibility.
Hey, Don, one quick question. Where's the new location being proposed?
It's right across from the Greenport Town Garage, the old Holcomb. You just remember the
Where CEDC used to be?
Yeah. Beautiful location. It's
Not St. Lawrence, the other one.
Holcomb.
Office building, yeah.
It's pretty much turnkey. And they're giving us a good deal, and they're also, off work, right off work.
That's the prison.
Mhm.
Oh, I'm sorry.
It's right before you get to the old conveyor belt. It's like on the right-hand side. But the deal, they're giving us a good deal. That they're keeping furniture. I mean, it's a win-win for us, right? Because it's a bigger place. It's going to allow us to do more networking with agencies. In terms of bringing, more, because our building right now, the only thing we host is the fair housing. We have on the chairperson for the fair housing with Bill Fisher. We host that, in our little building. But this would also give us more space to host more networking opportunities for the community.
Yeah, so I appreciate the really important work that the organization does. Obviously, from a public transportation standpoint, the easiest thing is to cluster destinations and locations like on the same route. So I think that we talked on the phone. I think the overall challenge is that it's great to be flexible in order to provide more service to more people, but the more deviations that you take, the more it might impact current riders. And so I would be hesitant to make like a one-off exception just for independent living center and not apply that to any other organization of an equivalent sort of deviation or public. So in some ways, it seems like you're requesting, right now we have a policy that anybody can request a 3/4 mile deviation. And if we actually need, I don't know, a 1 mile or a 1.2 mile, in some ways it's like, it's not that categorically different. Although at some point you have to have a cutoff somewhere. So the piece I don't know is like how many people would start riding it if we increased from 3/4 to 1, how many people would start riding it, but also how much would we get behind schedule if we're sort of adding a bunch of deviations. So I see some pros and cons to the proposal.
Well, there could be an argument, with Title II, with the ADA, that mile could be restricted, right? Even though you will offer it to others, that mile could be restrictive, especially if there's a center that is serving somebody with disabilities, right? So that there could be an argument that, you know, even though you offer 3/4 miles, that could be restricted. And obviously with ADA, when you, even though you offer to everyone else, if it's restrictive to a location, that could be a Title II issue, right?
What do you think?
Well, the concern is exactly what you said, is how far would it put us behind that schedule? By going that additional, how far does it go out now?
Right now the deviation is 3/4 mile. And so it ends, I think it goes to the end of Worth. To Warren and Worth, and it turns up towards the hospital.
Oh, okay, so it doesn't used to go out that way. I think it used to go out for Cas, didn't it go out there?
Yeah, and the Greene County does run a bus that goes by this new location for the Independent Living Center. So somebody could ride, that bus goes through downtown Hudson and then goes by the Independent Living Center. It's like the 7-11 teal bus. So somebody could ride from downtown Hudson, that bus to the Independent Living Center, or they could transfer from the shopping shuttle to that bus.
What time does that, what time would you need that, Don?
I mean, again, you know, we're open 9 to 5, right? So, but it all depends with appointments. So we can cluster our appointments around, so it's only, you say the bus is only limited, you know, we can do anyone with transportation needs in the bus, we can schedule it between like 11 and 1 or something. So it's not impacting, you know, well, our staff comes in at 9, so the meeting is in the morning, but it would be, you know, 9 o'clock. But anyone else that would appointment, you know, we could be flexible and schedule our appointments like 11 to 1, right? So if they need that transportation, it's not going to affect every bus, right? It's not going to affect every line, it might, you know, or every route or every time spot, right? So we can be flexible with that location. In terms of the county bus, again, we're back to restriction because their spots are only Warren Street, coming up Warren Street, right? So, you know, so that'd be great if someone's coming from Greene County because we do serve Greene County. But otherwise, you know, that could be because now we're restricting spots for somebody with a disability to that bus route, right? To say, well, you need to, you know, take Greene County bus because it goes on, you know, down Warren Street, but we're restricting the locations that they can pick up a bus.
Michael, does this impact funding at all? Or, I mean, did it state funding?
I don't think, I mean, I think the federal requirements require us to do a 3/4 mile deviation. That's my understanding. So like, that's what we're sort of following
Yeah,
those
so
federal requirements.
We're required to either, for this, we have to either operate as a fixed route with complimentary paratransit service at a level of service that is comparable, which we don't do, or we can have a alternative route deviation can be provided, but it should be available to all persons regardless of disability. So the standard that we put on that to be in compliance with ADA requirements is that 3/4 mile for anyone. So that's sort of what we're doing to be in compliance with the ADA service contractor's responsibility.
And we're proposing a mile, it goes to 3/4.
Right. It would be from that last spot. Deviation would be the mile.
And how many people are we serving with this deviation? How, your main goal is to try and get your staff to there or to your clients to the office?
It would be both, right? So again, it would be as needed, right? So, you know, if someone has to come, like we have someone right now that we're serving on State Street that, you know, walks up, right? So to renew some Section 8 stuff, right? So, you know, so it all depends on, you know, the need of the individual. The only one that, like I said, is the staff that lives in Hudson that would probably use it at least 3 times a week. At least.
The only other requirement we have with the route deviation aspect of it is that it needs to be called in the day prior by a certain time.
Mhm.
So is that something that you guys would also be doing, or are you also asking that we sort of exclude that as well?
Well, I think that if we establish, like, if the staff comes, right, and it's the same bus driver, right? I think that that person probably wouldn't have to call in if it's the same time every day, right? You know what I mean? Once it's established, I think if she picks it up,
What if there's a different bus driver? Because I mean, we can't, how would we be able to always assume that that same bus driver would be on that route? I don't know how Johnson does it, but I would assume on time, like everyone would have to take a day off, have to do those things. So I don't know that it would be necessarily the safest thing to assume that just for your employer or whatever too. Like, it would be really unfortunate if they hopped on the bus, there was a different driver and that driver was unaware of the additional accommodation.
I would think that
Yeah,
the bus
just-
company would teach all the bus drivers that, I mean.
Well, I do want to emphasize the importance of us having like policies that are like not super specific to an individual, right? Is that we want to say, here's how the route works. Like we can
Yeah.
publish it, we
Public
can
transit.
easily describe how it works. And so it gets complicated if you're like, by the way, here's how our route works, but like asterisk, like if this person comes on at 8:50, they want a deviation that always goes here. Like if that gets, that's like a complicated thing to both explain to the drivers and the public.
And
So-
any bid documents or.
Yeah.
Or
DOT.
brochures or things, anything like that too, that we're making publicly
It's really a
available.
change to the route.
It is.
Right,
I
that's
think,
what I was
I
gonna
don't think
say.
that we can do it as a route deviation completely. I think we would end up having to discuss just a route change as a whole.
I think that, as long as there's a, path to communication with the bus company, it's no different than calling a cab, right? It's just like, you're just making a prior notice ahead of time, right?
But calling a cab is a whole different thing. than
No,
public
I'm saying
transportation.
notification to the bus
Right.
company. No, I'm talking about notification to the bus company, say, by the way, I'll be using, a deviation from, prior notification to the bus company, right? It's no difference than having someone using that same method to call a cab, right? It's the same deal. A cab doesn't, without calling a cab, they're not going to come to your house, right?
Right.
So prior notification to the bus company, I don't see a problem, with that, especially, again, especially if we coordinate that in the office, right? Because we already do that now with Medicaid transportation for some individuals. Some individuals can't use whatever the reason. So if someone needs Medicaid transportation, we provide, the Medicaid transportation, notification for the individuals. So I don't see an issue, with that being, put into, the plan.
But that's not normal public transportation. As Michael said, normal public transportation is an established route, and this is what you do
Every day.
for every day, everybody,
Well, and it's.
services like healthcare consortium or Medicaid rides are more like calling a cab. Is what-
You've got to think of the riders who depend on that normal route. And I guess the question is, and Marissa, are you saying that we would probably, if we change, we'd have to put out another map with this on the,
I
If
feel
it's
like
every day.
or 3 to 4 days a week, I
Yeah,
think
this is the
ultimately, yeah, you
This is the
would probably
This is-
do a change.
Just make it part of the route. Yeah.
Yeah, I feel like that's honestly the better solution overall to not get, to be able to accommodate, but also not receive the additional.
But all of our
complaints.
contracts are based on the route.
Right, with that 3 mile deviation, so that's included in on all of our contracts, things like that, but as this would exceed that, I just think the safest option is really, do we change the route or do we not? I don't think it's as much a question of like deviate.
That's where I was trying to get a handle on how many people were
Yeah.
utilizing it on a
Yeah.
daily basis
Yeah.
or weekly basis or something.
So that's why I think where it comes, that's why, in terms of, it being initiated by the rider, right? Because there's no, I would hate to have it doing every day and we're only doing three people a month, right? Because of the need of the individual. Because it just comes down to.
We're trying to weigh, yeah.
But if it's
Right.
3 times a month, but you have an employee who's going in 3 to 4 times a week.
yeah, I don't, we can't be getting enough for the.
It's not deep. Yeah, so I guess what I'm hearing, can we like also circle back with our staff attorney and just make sure, like double check our,
Yeah, I was
both our
gonna-
contracts and our ADA compliance?
Yeah.
So we certainly want to make sure that we're we're following the both procurement and the accessibility rules. Have you, I guess, are there other dial-a ride services that could also, because in some ways, especially for the shopping shuttle, it's really dealing with like the mass transit of volumes of people. And so, I think it covers 85 or 80 people a day. And so there are people who it's already a long trip for them. And so that's the reason why you're trying to limit the complicatedness of the route. So I would wonder if there's like a dial-a-ride solution that would really address this one person, whether it's DSS or Office of the Aging. If there's some other agency that already provides dial-a-ride.
She wouldn't
And-
qualify, she's too young, she wouldn't qualify.
And then, or could they ride there is transit, there is the 7-Eleven bus, is there a way for us to figure out how they could get?
Somebody in wheelchair, I do serve somebody in wheelchair, but somebody in wheelchair cannot use, she qualifies Office of Aging, but Office of Aging doesn't provide transportation for somebody in wheelchair. They have to be eligible to be capable of getting in the van. Right? So there's limitations on that side of it too.
Can I suggest, Michael, that maybe we bring together our other departments that provide transportation? And see what options may be available.
So let's talk to the transportation providers and see. I really want to make sure that people can get either to work or to get services there. But I'm also hesitant to make a decision today about changing the route.
Without knowing all the options.
Well, this, that's why I appreciate the time frame because we're hoping to be in, we're looking at hoping to be out and in by February 1st. So this is going to be a real issue if we can't get our transportation for individuals that need it. In terms of service. So, but I mean, I would definitely, if you want to, at least get back to me in terms of if the attorney says anything in terms of restrictions. I mean, I have a letter at the office, a template for ADA Title II, referring to transportation and, between cluster transportations and also, in terms of different things that, because it wasn't originally the route, for some reason, initially it was a 2-mile radius at one point.
I don't remember if I've been on transportation, it being a 2-mile radius.
Yeah, I don't remember changing that figure since the transportation committee got created.
Yeah.
That's been consistent.
Now, do you provide transportation to Whittier?
That was, I think it's Whittier, that was on one of our original weekday routes. So it's not an everyday service. It's not anything like that. It's built into a specific route in which we travel past that location. And do that. I think it's 1 or 2 days a week. It may actually be 1 now after COVID. I'm not sure which route that hits on.
But that to fulfill
But again,
Dominick's needs, I think there's other
that was
agencies that can
accommodated.
help with that.
Yeah, route, or is that just,
Nope, that's on, I forget which one it is. Like,
And that's the same thing, the Columbia Green route, when you provide the Columbia Green route?
I was not a party to that, so I can't.
I think
comment
social
on that.
services did that for a while, and it didn't really pan out. There was no ridership.
Great, but that was, and that was a scheduled route. fixed
Right, it
route.
was a scheduled route.
Yeah.
Healthcare, I mean, I would hate, because we use healthcare consortium, for transportation for individuals for health reasons. I would hate to have to take away, and they're already staffed now in terms of, I would hate to take away a medical appointment for something like this. Right? Because way back when Medicaid did provide, you could take medical transportation to the office until they realized that, the service you provide didn't constitute medical. So I would not take healthcare consortium that,
Okay.
that to me, that would be, more of a disservice to more people that need it. for the healthcare reasons.
Well, I think like I think there's 10 or 12 different agencies or departments that provide transportation that do the Styler ride. So we'll circle back and see if there's a good fit for one of them. I will emphasize that there is transportation to this location. It just doesn't originate in the location that you want. But I don't know if we'll be able to get a solution. I guess if you're looking to like sign a contract within a month, it's a tight time frame with the holidays. So that we will sort of like move as fast as we can to like keep you posted.
To answer your Whittier question, that's on the Livingston route that only runs on Thursdays. So it's been built into the Livingston route. And it's only that one day.
But is that something that we could think about, right? Because again, if it's, the staff person, right? If we do it where, like they do for Whittier, that it's only 2 days a week or something, right? Or 3 days a week, then we know the schedule of the individuals for those days, right? And as of the staff, then, they know that, maybe take an alternating for the other two, like a cab, which is, you take 5 days a week, you just burned up 2 hours of your work pay, right? Because it can be expensive round trip. So is that something to say, so that also then, allows us to say, okay, we schedule it these times. That's when it's available, kind of like the Whittier thought, right? So we're not scheduling on a Monday or Friday or whatever. We'll schedule one a Tuesday, Tuesday.
I think for the shopping shuttle, which is a little different than the county routes, like it's a route that a lot of people use, and it's important that it runs on a regular schedule. So it's sort of like any change that we make are going to affect those like 80 people per day. And it's part of the way that it functions, that it has a structure and it's consistent. So if we're going to make a change, I think it's not that I'm not open to making a change, but we have to consider the whole bulk. So I think the challenge is sort of, if you came in and was like 40 people are going to ride this thing every day, like that would be like a real good, that'd be like an obvious case to be like, oh, we should totally make a change to increase it. But to like, in some ways, to potentially make it harder for 80 people a day to ride in order to accommodate one person is a challenge. And so at this point, I would certainly want more information before we make a decision, which is both like, what are the alternative ways to get that person to the site? And then also like, what do our current riders think about a deviation that would impact them?
Yeah, I mean, and I would be curious on, the current riders that if this is made available, maybe they have a need for our services, right? So, that's another thing, right? I don't know who's taking it, but it could be a possibility, especially if you're picking at some of these locations that, knowing that there's availability for them to use it to get to, for their services.
Do you have any other questions or comments?
No, I'd like to, like I said, all the other agencies that provide transportation and see if there might be some options there.
Do you know what the other agencies are?
There's the Office for the Aging, there's Department of Social Services, Healthcare Consortium. There's quite a few. I'm just off the top of my head now.
All right, well, thank you.
Thanks for coming. Okay. Next item is shopping shuttle hours. The last time I think we met, we had sort of looked at this, I think almost like a $200,000 budget gap for this extended hours. We've had some pros and cons since then. So we've actually gotten a significant amount of money from the state via federal funds, sort of like reapportionment federal funds. That there was like a big chunk that's sort of apportioned in like these different categories. So they gave us a bunch from like that's allocated to previous years. And then they increased our yearly allocation by $50,000. So I think we have a total of about $200,000 that have come in since the last time we met. So that's great news. Potentially fills the gap. some of it is a portion for previous years. So I think it's like the money is there. I think that might give us the pushing that we need to add to another year. But on the downside, it doesn't necessarily solve a long-term funding structure. Although the way that they describe how their funding worked, it just sort of seemed generally unpredictable that like, could we get more next year? Maybe. So I guess that's sort of like my general overview. I don't know if Tim Mercy you wanted to add to what.
No, I think our assumption going in was that some kind of we would get this funding automatically based on the additional miles and passengers, and that hasn't happened. But I think we're heading to another application period. I just got the stuff for it, and I don't know if we, and part of that, we can maybe get for funding. I don't think we'll ever close to 200,000. But like maybe this, if they're giving us an extra 50 to 53 or whatever it is, that, closes it a little bit. I know that we've had previous discussions with ProPark about reducing the hours for the routes. And if we do that, then they're just going to raise our price because they have a full-time driver they got to pay no matter what. So I think it sounds like it's almost all or nothing with ProPark to do it with. I think we just keep going back to DOT and getting funding.
So,
Well, we started this with the idea that since we're only serving Hudson and Greenport out of this, we would ask them for funding. Where are we with that?
Hudson and Greenport, you mean?
Yeah.
Well, Greenport told us absolutely not.
Well, I don't know if that was an official word, but I heard it from Kathy. But I assume that Hudson would be interested in this.
Did you say it that nicely or?
It was pretty quick.
With a howling from it.
Right.
Hell no.
Right.
I mean, that was the summation I got. It was that Greenport was not interested in contributing.
Yeah.
Hudson was interested in contributing. And I think we talked about it last time. I'm not sure how much it makes sense to have only Hudson contribute and not Greenport, since it serves.
Sounds like the library all over again.
Yes.
Well, I think the problem with Greenport was they just had the library budget in
Yeah,
place.
yeah, she
So I
was in the
think if
middle of
you-
budget season.
I think if you approach it for next year, like you submit it now to Town of Greenport and say, listen, this is statistically, then they can possibly
it's
budget for
benefiting
next year.
Most of their businesses
Right.
on Fairview.
Yeah.
I just think it was at the wrong time. Budget,
Yeah,
it was, after
Is
prime.
it out of line
preliminary
with
budgets.
places like ShopRite and say,
They actually, they try, maybe we could try. I know that Spark of Hudson did, they went to the chamber and they went to CDC and then they sort of asked the biggest businesses on Fairview. They did not come up with it. So, I mean, I think Greenport is not going to contribute this year. I guess one compromise could be that, hey, we'll do it for one more year. And here's the expectation. If we don't get X in federal funding and X from Greenport, an X in from Greenport Hudson as far combined,
right.
it's that's it or something. But
So you think Hudson would do something if Greenport did something? Is that the
yes,
official comment right now?
right. That wasn't a past resolution. But
Yeah,
yes.
right, I get it.
Yes.
well, we can, let's get through this. Maybe we can talk to Kathy.
And I think, Kathy had some rumors that, may not be necessarily accurate either. So I thought explaining this to her if we were interested in trying to maintain it.
Do we have any understanding of the ratio of people?
That's what I was just gonna ask,
Hudson and
from
Greenport?
Greenport.
I mean, Kathy's out there speaking against it, and she might not even have the slightest idea how many Greenport.
Right. And how many do they pick up from?
That one by on, Town Hall Drive, that whole apartment complex.
Right,
They stopped there and I know they picked people up there,
right.
taking shopping.
I was hoping we'd get a little press on it and get people, residents to say, well, I want you to do that, and go to the elected officials. And I'm not opposed to trying to help fund it. We have to help funding it, but I just see it as an action that really serves two communities within our county and they should help.
The
Yeah.
funds that we're receiving from the previous years, have they been allocated to anything already?
So we got some COVID monies that we're sort of going to use towards, once we finish this kind of because we lose money on Johnson and transportation too. So we're kind of plug that hole with that money. But there is 138 and then 50 from the other 2 years that we didn't plan on getting that and plan on that. But again, we operated a deficit with Johnson, we operated a bigger deficit with this, so. Depends on what goal you want to look.
Right.
That helps the overall.
Are those funds that could also be used towards a bus or
They
is
can't
there
be used
something
towards
for?
that.
Oh, that's good.
They can or cannot.
So you're saying, Michael, that with all the funding that we have enough to get us another year?
That's my understanding, right?
Yeah.
Yeah. So it's like, I guess, yeah, it's like, we had a $200,000 gap and we've gotten $200,000. It's not specifically apportioned for this, but it's certainly, I guess it's like, we have the capacity to put it towards this. And if we took Pro Park, we'd probably be leaving some grant money on the table. It's not I think the downside is that it's no guarantee that next year that we would get it again. So we're still sort of facing the same conundrum of it feels like we're just pushing, like we're just kind of getting by for the year, but we sort of did magically come up with the funds that we, like the gap that we needed since we last met. So that's the pros and cons of trying to present.
I'm not adverse to kicking the can down
Yeah.
the
Yeah.
road. As long as we let everyone know that. this
Right.
is-
Yeah, I think we have to start talking about it in early summer next year.
I think maybe before, because if we're gonna have to break the bid, I'm gonna
Oh, we
need
have
to
a bid.
know
Why
well
don't we send
before
a letter
the
to
summer
the city of Hudson and
about writing the bid. 'Cause We're not gonna
Well,
put
yeah,
out
we
a
should
bid.
have a conversation with Kathy.
When she said no, was there any number thrown at her?
No.
But, that's my point, Rick. It seemed like she had already been told, she said, I understand Sparks got a lot of money, they don't want to give it to us. And so there was, something was already in her
Mark
information.
doesn't have an obligation to her people, she does.
Right?
The other piece that I've heard people mention is that the cannabis money seems like it's largely derived from Hudson and Greenport. And I had the council president from Hudson had recommended, like, could the cannabis money, the county's coming in.
They already
We've
get
already-
75% of it.
Right.
We keep a very small percent of that.
Yeah.
And we've already dedicated that to offset the current budgets.
Yeah.
Now, it may be more money.
Right.
We don't know.
But the town and the city
Some
could use it,
future,
where's it?
Yeah.
They get.
If the town gets it and the city gets it,
There you go.
there you go. There's their answer, You want to take care of your residents, go ahead. I do know that, there's people that use that and they're, I hate to turn them down for that shopping shuttle, but, and where are we with the contract? I thought we told them we were gonna end that contract in March, isn't it?
We were gonna wait for the,
Okay,
Yeah, so
so we
we-
haven't officially responded to them.
they know nothing about it.
That's
Yeah,
why,
Alright.
we haven't
partially
been
why
able
we're
to-
having this.
Yes,
Okay.
that's like, we need to make a decision.
I didn't know if we had already told them we were gonna cancel that or not, and we can renew that contract right now at the rates they gave us, or we have to rebid the whole thing.
No.
No, right now, we're on like our last, I think it's our last contract
Our last.
period here, which is why. So I would say for like timeline estimation, probably by like second quarter next year, I would probably need to have some idea of if this is gonna be something that we're gonna rebid or
So when
not.
does this
so that
one
I can
expire?
do everything.
The contract,
This starts in, I think it's March 2025 through March 2026. So, but then in terms of writing the bid, getting the approval.
and that already came with an increased funding, right? Cost rather.
Yeah, increased cost. And I would expect that when we rebid it, that cost will,
Go up again.
The bus bid that we just did, where are we with that?
waiting for DOT. Yeah. so
They
we
said they
sent
would
that.
expedite that.
Yeah, we're gonna expedite it and it's been a
Okay.
while. So my intention is to follow up with them probably this week before the holiday. Try to get it back on there, but yeah, we sent it I think, the first or second day of December.
We also have the 200,000 for Chatham that's kind of hanging out there.
Right.
Yes,
Right.
yeah, that's contingent on
And we're
some.
waiting
of that as well.
for an answer from them as
Yeah.
well.
Yeah, so they had come, they were 200,000 for Chatham and DOT basically had said, can you spend all of it before March or something?
Yeah,
Which
so it was
ser-
before March.
which
They want
was
us to spend
totally,
the whole thing
totally
before
useless.
March.
It's like, you want us to run a pilot program for 1 month? Like, no, we
Can we
don't,
buy a bus with it?
we don't want to do
Can't even
that.
do that.
So we're discussing, could they either extend that, I mean, they sort of came out at the deadline like last minute. I mean, when the when the assembly member and senator talked to us about the funding, they had always talked about it as being a long-term project. So can we either extend the deadline past March 2023, or I'm going to actually email them today and offer, they offered maybe wanted us to prepay, which I don't love, but I guess it would be fine. And just like sign a contract with Johnson, prepay Johnson to get the grant money.
Well, that's the way most state grants run. They're cost reimbursement grants, so.
No, they had maybe been interested in us. Yes, right. So we would
But we're not
pay Johnson
Paying
before
for
the
service,
service.
we're prepaying.
Yes,
And then submit the vouchers to the state for
Yeah.
the reimbursement.
right. So that we would have paid Johnson before March. They would pay us.
No, they would pay us. Because DOT does not want this money after April 1st. It's in this year's budget to them. So we would have to pay John, they would reimburse us before April 1st or, it would be dated before.
There's that thing in our procurement policy, if we're paying for something we haven't received yet under the contract.
It seems like the wrong way to do it because basically giving Johnson the interest
Right.
of the state.
And
Right,
I think even with that, like doing the math out, I think a year is only gonna cost
Right.
us about $50,000.
Less than that.
So then we'd have to be doing this. We'd be paying them for how many
4 years.
years in
Yeah,
advance
It's not a
for
great. it's not
a
a great
brand
solution.
new route.
But
too.
they also gave us the opportunity to throw some more costs in there, so we could
Yeah.
take some of my costs versus costs and put it in their insurance and things we usually don't get reimbursed for. And even if we bought a bus or something, we could put a percentage of that new bus towards 200 grand, whatever percent of the route Chatham is, which would be a little bit. They're trying to be flexible with this, but and we're still waiting for them to let us know if we're running out of time.
Like first March. So it's messy, but we're.
Yeah.
Just tell them to give us a check for the 200, we'll take care of it.
That's
right.
We'll have no problem spending it.
Dee says we're good for it.
Yeah.
So am I hearing that we have support to move forward on the shopping shall extended hours? For the money?
Yep.
One more year.
But I would ask that you and Rick sit down with both the city of Hudson and Greenport and try to develop a plan, you know?
Right, so I will send that to DOT for approval ASAP. I'll wait for their approval on that and then we'll put it through resolution.
Do we need a resolution here? Should we do that?
Someone want to make a motion to,
Someone make a motion?
I'll make a motion.
Second. All in favor?
I,
All opposed? Okay. Well, thanks for your support and your patience.
Thank you.
We would like to know the data. Somebody who we got to tell Mike, maybe they could find out a way to let us know how many.
people they picked up in the locations. in
It's
Greenport.
a lot easier-
Greenport City.
I would
within
think
the
it's more
limits.
than the city of Hudson,
it's
don't
a lot
you?
easier to negotiate.
Yeah.
Like the
Figure.
senior, all the senior housing.
Yeah.
But as to Rick's point, I mean, they're taking them to the stores in Greenport for the most part.
Right.
Which, you know,
If Greenport doesn't get 100% of that sales tax revenue, they're
Can you get that data from? See if,
From Mike,
yeah.
It'd be- I think it'd be
Jim
anecdotal.
Riley,
It
yeah.
would be anecdotal.
That's it, there's no,
Yeah, I don't
and
know.
it's pro forma from that, Mike. Right?
Oh, that's right.
Yeah, yeah.
Yeah. Just the extended, yeah.
Right. I mean, on the flip side, if no one was riding in Greenport, I would probably cut out some of those little loop deviations, I guess, as per like our earlier conversation. So I think that route is longer than like for any one person, it takes a lot of deviations, which is inconvenient. So if no one's getting on those extra little deviations,
to the Pro Park route.
yeah, we could cut it down to an hour.
I mean,
instead of
wouldn't
an
the
hour.
driver be able to tell you, like,
Right.
I'm not picking anybody up
Yeah.
from this
Right.
location
Right.
or, and I'm sitting there waiting for 5 minutes, you
Right.
know, or whatever. Can you get a feedback from Pro Park? I guess that
Yeah.
would kind of be the drivers of Pro Park
I mean, I've heard anecdotally that people get on
everywhere.
everywhere. Yeah. 'Cause I also get questions from people being like, I live in Greenport Manor, like, how come there's no transportation? And you're like, oh, actually there is. So
So I
like,
don't know, yeah.
yeah.
Maybe we'll take a ride. Field trip.
Yeah, right,
The
yeah.
whole route.
You follow the bus on that.
Yeah.
Oh, really? But it doesn't tell you how many people get picked up.
I have seen it in the stores on the weekends, you know. I mean,
Yeah.
Oh, I've seen, yeah, I passed it a few times at
Right.
Walmart and
Yeah, right.
TJ Maxx and all that good stuff, so.
Anything else? All right, motion to adjourn.
So move.
All in favor?
Aye.
All opposed?
Happy holidays.
Yes.
Got it.